I'm Professor Alan Jackson at the University of Southampton, and I'm Director of the Biomedical Research Unit for Nutrition, Diet and Lifestyle at the Southampton University's NHS Trust and the University of Southampton. We are very interested and concerned to help to reduce the number of children around the world who die of malnutrition. Everybody is very familiar with an emergency, a famine or a flood, where the aid agencies come in and provide relief food and do an extremely good job in helping to ensure that people don't die, and particularly children don't die of malnutrition. However, what we don't realize as obviously is that on every day there are millions of children around the world at risk of and who actually die of malnutrition, who are simply ignored. They're not caught by the regular services, or if they are picked up by the services, they aren't treated as well as they ought to be treated. And we want to ensure that every child has the opportunity of being treated as well as possible. Ideally, we would like to prevent the condition, but those in whom it's not been prevented, to ensure that they are treated in the way that we know they ought to be treated to save lives. Well, there's a wide range of target audiences, but particularly we're concerned that paediatricians, who are the professional group who accept responsibility for caring for children, are able to do the things and manage severely malnourished children in an appropriate way. Sometimes when the children are very sick, the approach to management is very different to that for children who aren't malnourished, and many paediatricians aren't aware of those important differences. And we'd like to ensure that they are aware and that they can better do the things that need to be done. And of course, the people who actually look after children more often than not are nurses, senior nurses and others. And we'd like to ensure that in their training and their practice, they're able to recognize the problem and adopt best practices and ensure that the sometimes relatively simple things that need to be done are done well. And we know that if we take the guidelines that have been developed by the World Health Organization over a number of years, if we take those to even very resource-poor areas, rural areas in the developing world, and train the nurses and doctors to do the simple things well, then they can have a substantial effect upon the likelihood of children living. So rather than every other child dying of malnutrition, you can reduce it so that less than 1 in 20. So you save an awful lot of lives. And we'd like to achieve that as an opportunity for every malnourished children wherever they are in the world. Well, the particular focus of this activity is managing severe malnutrition. We have other areas about preventing severe malnutrition, managing large numbers of children in the community, and looking at growth and development generally. But for this particular activity, we want to make sure that those who are at most of risk of dying have available to them the care that ought to be routine and ought to be standard, has been well tried and tested and shown to work, whether that's in Latin America, Asia, or Sub-Saharan Africa. Importantly, there's a particular focus on Sub-Saharan Africa, where the greatest proportion of children die, but also an important focus on India and the subcontinent, where the largest numbers of children die. One of the difficulties that we have had over many years is that we know that if you go to a center of excellence or places where people are skilled, we can make an important difference. The challenge is that most of the children who need the care aren't in those centers. They're in more remote rural areas where the opportunities for learning and training and education are less good, and access to those people is harder. That the opportunities for training are less, and therefore we were very keen to explore an approach that would enable us to access wide numbers of people, large numbers of people widely dispersed around the world, and bring to them an equivalent standard of opportunity for care or learning as anywhere else. So it didn't matter where you were in the world, how remote you had the opportunity to learn the same basic principles to the same standard, and therefore adopt the same standard of care using similar, simple approaches.